is Deb Campbell, who is a professor of pediatrics at Albert Einstein College of Medicine and chief of the Division of Neonatology at Children's Hospital there. Her research and clinical interests include health services delivery, perinatal health equity, ethics, perinatal palliative care, care transitions, and outcomes for preterm medically complex infants. So she's a member of the APS, and she has written many, many of the books that we use all the time: the Bright Futures Guidelines, the AAP Textbook of Pediatric Care, and editor of Neonatology for Primary Care. So thank you, Deb, for wrapping up this great panel discussion.
Thank you very much, Renata, and to everybody who's spoken before me. I think this is a wonderful venue, and I want to thank those that spoke before me in terms of really sharing their reflections. And I think we all have so much in common. My path is a bit different, though I also had the opportunity to take advantage of unexpected opportunities. And I think that was one common theme that you heard throughout the presentations before mine. And also that each of us had an intense drive. For me, again, it was a little bit different. What fueled sort of the work that I've done over the past 3 decades was really driven by a need to find meaning after the death of my 27-weeker 36 years ago. And that really sort of set a frame for me, in addition to finding myself with these unexpected opportunities, first as a division chief, well, first as a site director for one of our neonatal intensive care units and newborn services within the Montefiore Health System. Unlike the other presenters, I really have spent my academic career in one place. And then subsequently as division chief a number of years later. For me, I think highlighting again some of what has been said, the importance of having not only mentors, but promoters and supporters was really key. I was fortunate to have a division chief who was a tremendous mentor and also a tremendous advocate for me, who got me involved in a number of professional organizations at the state level. And then also through the AAP, initially, what used to be the section on perinatal pediatrics, attending a Scottsdale meeting where I had the opportunity and honor of meeting Joe Butterfield and being invited to one of his dinners, where he would actually each year invite a few of the younger attendees to sit and have dinner at a local restaurant. And that was part of the entree into the section. That subsequently led me to become the District 2 rep for New York State to the section, and then ultimately to have the honor of being chair from 2004 to 2006. I also, again, through these various linkages and introductions, was fortunate to be able to get involved with both our state and city departments of health and the other organizations that aligned with them, March of Dimes as well. And that really helped provide a venue for me to be active in advocacy work and really working on health services delivery, looking at outcomes, looking at opportunities to improve the health within communities beyond working just within the hospital setting. I think, as was said, in terms of the biggest positive of being a leader, several of the speakers have noted this, the ability to affect change, to impact culture, to impact practice, whether it's, again, within your local hospital setting, to really foster cohesion, growth, and success. And then also, in tandem with that, garnering organizational support and recognition for the entire team, which certainly takes a lot of effort, as everybody has described, but really is a source of satisfaction and a benefit of being a leader, as well as the honor of being able to serve nationally through the academy, and specifically the section on neonatal-perinatal medicine. Related to some of the greatest difficulties that for women to overcome in becoming leaders, I think, again, it's been summarized by many. It certainly relates to the challenges in related to minefields that are seen and unseen. It includes dreams deferred. Many of us have had one path in mind, and then we take a circuitous route, and we may come back to that path or end up on another path. And I think that one of the other challenges is certainly a strength and something that gets us recognized and gets us offered leadership roles, but really is also the cost of being considered competent. There are also costs to being the one or the token, where you find yourself with many additional responsibilities or requests for your efforts that sometimes can really take away from your ability to accomplish what your goals are. And this is something, you know, as we talk about in terms of balance, that we all need to be mindful of and prepared for. Several of the other presenters did note the challenge of how others perceive you, whether it's members of senior leadership, whether it's the men and women that you work with, how you're viewed, whether you're considered worthy, whether you're considered the fixer or the sustainer. And certainly I think we've all in some way become really cognizant of that glass cliff. Recognizing, again, life happens, and it happens to all of us, and thinking about how we take advantage of those opportunities in life, and even if you need to take a different path, to think about, you know, how can I continue to do the things that give me joy, give me passion, in terms of achieving your success and really achieving what you hope to. Mentorship, finding somebody to emulate, finding those supporters, promoters, and advisors is really important. And that is an important strength of a group like WIN and all the other mentoring and networking opportunities and relationships that we can all build. I think, as was said, in terms of mistakes that women make in their quest for leadership positions, does relate sometimes to the power of observation, not necessarily understanding the culture that you're currently working in or hoping to enter. And then that dichotomy of promoting others at the expense of ourselves. While certainly we have responsibilities to really promote those with whom we work, certainly bringing up younger faculty, fellows, trainees, the other professionals with whom we work. Sometimes it really is at the cost of yourself. And I think it's something that we need to be cognizant of. We can take joy in seeing others progress, others really be successful, but it can impact sometimes what we're able to accomplish. Just as Rita had mentioned, in terms of doing something a little differently in my career, I think for me, I would have gotten my MPH. But again, life happens, and the best laid plans sometimes don't come to fruition. I think that the need to really achieve balance and balance in one's life is really very important. And it's what helps allow us to really enjoy what we do and feel satisfied and successful in you know, the path that we've taken. For me, so it was balancing prospects in terms of, you know, what my goals, what my aspirations were with that of my life partner. My husband was a clinician, set up a practice, and being able to, that which limited my flexibility in terms of being able to move. So you work where you are, and again, achieve success, achieve happiness and joy in what you do. So I don't, I think one of the challenges sometimes is that for some women who, or just some leaders who may choose to remain in one location as opposed to taking on other opportunities that would require a big move, there can sometimes be a sense of, well, maybe I'm not doing as well, or maybe, I've lost out in some way. But I think that we all have important roles to play. And we all can help guide others to be really effective in terms of contributing to the field and to individual success and fulfillment. Thinking a little bit about qualities to maintain leadership positions, I think just summarizing what has been said before, believing in oneself, trusting our instincts, being willing to nurture, the importance of being mindful, and that focus on achieving your goals and really trying not to lose sight of it, even if the path is not straight. Recognizing and valuing building and leading teams is also critical, lifting up others, as has been said. The importance of really trying to foster and achieve equity and equality for those with whom you work, and treating others with respect. A willingness to really question the status quo is important. There are always opportunities for growth and improvement. And we need to not just think about the grand picture, but we need to think about small perspectives as well, all the while keeping an open mind, and not being afraid to ask for help, as was said. In terms of advice from my younger self, I think, and for those of you who are coming up along the way, finding your voice, as well as knowing your strengths, recognizing that you are courageous, you're creative, you're resilient, you're tenacious, and you are passionate. It is equally important to be humble, as well as to express gratitude and be kind, and all the while trying to find joy and maintain joy in all that you do. I think the other piece is remembering, again, as has been said by each of the presenters, life happens. So the importance of finding balance and self-acceptance with whatever that new balance entails is really vital. Because we all struggle with times when we feel not competent in any facet of our life, and we all have to come to terms with that. And I think that my final thought is really just to be sure to engage in and celebrate what gives you joy, because that certainly is what's important to the field and what's important for our own personal growth and satisfaction, and really as a collective, raising each other up and supporting each other.